Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is pemphigus group of disorders. Hopefully you will learn and subscribe my YouTube channel. Definition: it's a group of autoimmune blistering disorder characterized by presence of antibody against desmosomal ADN protein. Introduction and general description. The word pemphigus is derived from Greek word pemphix, which means blister or bubbles. The primary pathogenic antibody is targeted against desmogallin 1 and 3, which contributes to structure of desmosomes. It is associated with class 2 HLA allele. Epidemiology: age, sex, ethnicity, and associated disease. The incidence of pemphigus is about 0.05 to 2.7 per 1 lakh per year. Pemphigus vulgaris is common in USA, Europe, and India, while pemphigus foliaceus is seen in Brazil and Africa. The age most commonly is about 40 to 60 years of life. Pemphigus vulgaris also occur in children. The diseases which are associated with pemphigus vulgaris include autoimmune disease, thyroid disease, rheumatoid arthritis, type 1 diabetes, and paraneoplastic pemphigus. Pathophysiology: desmogallin 1 and 3 are the main targets of antibody. These desmogallin 1 and 3 are expressed in skin and mucosal tissue. Skin epiderm contain high level of desmogallin 1, whereas desmogallin 3 is found in basal and immediate suprabasal layer. In oral mucosa, desmogallin 3 is found in all layer in higher level, while desmogallin 1 is found in lower level. Both antigen work cooperatively. Antibody targets desmogallin 1, but it do not affect oral mucosa and it can affect skin epithelium, whereas antibody which targets against desmogallin 3 leads to severe mucosal blistering as there is a little desmogallin 1 to compensate. This is the mechanism of compensation hypothesis. In pemphigus foliaceus, antibody targets desmogallin 1 protein, causing skin blistering without mucosal involvement. Moreover, in pemphigus vulgaris, antibody targets desmogallin 3, which may cause mucosal blistering. Antibody in pemphigus. Mainly IgG antibody have been demonstrated by direct and indirect immunofluorescence testing. Less common antibodies are IgM, IgA, and IgE. Antibody do not only target desmogallin protein, but it may also target desmocolin, plakoglobin, E-cadherin, and acetylcholine receptors. About 85% of patients of pemphigus vulgaris have been noticed to be have involving acetylcholine receptor antibody. Antibody may also weakens desmosomal junction and prevents desmosomal reassembly. This picture describes the deposition of antibodies in skin epidermis. These skin epidermis, especially antibody, is deposited in membrane of keratinocytes as seen in uppermost area of this picture. This picture shows direct immunofluorescence of antibody deposition. Acantholysis and other mechanisms involved in pemphigus. Separation of keratinocytes from one another have been seen, although it is not a pathognomic sign of pemphigus. Other mechanisms involved are steric hindrance by anti-DS antibody, protease activation, and disturbance of intracellular signaling pathway and apoptosis are seen. Environmental factors: the patients who are living along river area are most commonly affected. Black flies especially Simulum species. Those who are in endemic area, 50% normal men have anti-DSG1 antibody. Moreover, surprisingly, smoking has been seen as a beneficent in pemphigus patient. Pesticides, especially organophosphate and garlic, may aggravate pemphigus disease. Drug causing pemphigus. There are a list of drugs which include both thiol group and non-thiol group. The thiol group, especially penicillamine, it is the most common culprit drug for causing pemphigus. Non-thiol drugs include AC inhibitors. Moreover, other drugs which includes glibenclamide, cephalosporin, rifampicin, pyritonol, phenobarbital, and aspirin have been seen. Thank you very much. Stay connected and subscribe my YouTube channel.